Today, we're gonna talk about ABSI. Definition of ABSI. ABSI stands for Ankle Brachial Systolic Index. It is actually a clinical tool used to assess and diagnose a peripheral arterial disease. Instruments needed to perform an ABSI are first handheld Doppler ultrasonography, ultrasonic gel, and manual blood pressure cuff. Before performing an ABSI, we have to instruct the patient to lie down in a supine position and rest for about 10 minutes to make sure that BP is stabilized. We have to basically this is actually to prevent the hydrostatic pressure to affect the measurements of the blood pressure. Then next, we have to inform the patient not to speak while the test is being performed. Steps in performing ABSI. First, the test is initiated by taking brachial systolic pressure measurement. We have to apply the BP cuff on the patient's arm and leave an adequate space for brachial arterial access. And then we have to identify the surface anatomy of the brachial artery, which is it is medial to bicep brachii tendon at the anterior cubital fossa. And then we have to apply the ultrasonic gel on the handheld Doppler probe. So basically, this is actually a picture of a handheld Doppler probe. And then we have to listen for a brachial pulse and signal and determine the signal waveform, whether it is triphasic, biphasic, or monophasic. And then we have to inflate the BP cuff until the brachial artery signal disappear and slowly deflate the BP cuff until the brachial artery pulse and signals are audible. The pressure where the brachial artery signals is reappeared is the brachial systolic pressure reading. Repeat the same process over the contralateral arm. And then the next step would be choosing the highest brachial systolic pressure between both arms to be the denominator of the ABSI. And then the next step will be taking ankle systolic pressure measurement. We have to locate the dorsalis pedis artery, which lies between extensor hallucis longus and accessor digitorum longus tendon. And we have to also locate the posterior tibial artery, which lies between the flexor hallucis longus and flexor digitoris longus tendon. And we have to repeat the similar procedure, but we have to start with dorsalis pedis artery first. We have to apply the BP cuff above the ankle joint, and we have to put ultrasonic gel on the handheld Doppler probe and listen for dorsalis pedis artery pulse and signals. And just like before, have to determine the signal waveform of DPA. Then we have to inflate the BP cuff until DPA signal disappear. And then we gradually deflate the BP cuff until the DPA signals is reappeared, and the reading present is considered to be ankle systolic pressure. And then we have to repeat the same process for posterior tibial artery of the same leg. And then the next step will be finishing the process by choosing the highest systolic pressure between the dorsalis pedis artery and posterior tibial artery to be the numerator of the ABSI for that leg. And then we have to repeat the same process on the contralateral leg. The last step would be calculating the ABSI for each leg based of the denominator and numerator that have been measured before. So basically, this is how you measure it, how you calculate the ankle brachial index. For right ABI, basically how we calculate is basically we put the higher of the right ankle pressure, we can choose between posterior tibial artery or dorsalis pedis artery, and we put it as the numerator of the calculation, and then we put higher arm pressure. We can actually choose the highest one, whether it is right or left arm, and we put the reading as the denominator of the calculations, and then we just divide them, divide the reading. For left ABI, equals the ratio of basically higher of the left ankle pressure. We can actually choose between PT or DP to the higher arm pressure. We can choose between right or left arm depending on the highest arm pressure reading. And then moving on to the interpretations of the reading or the ratio. So basically, if the reading is more than 1.30, then it indicates that the vessel is not compressible, and that it's not compressible, such as and this situation usually happens in patients who are diabetic, heavy smoker, or yeah. And then if the reading is between 1 to 1.29, it is considered as normal. And then if the reading is about 0.41 to 0.9, it is the patient, the interpretation would be a mild to moderate peripheral artery disease. If the reading shows about less than 0.4, it is considered to be severe peripheral artery disease.